This video is for general information only and isn't a substitute for medical advice. Always speak to your GP or a qualified healthcare professional about your own situation. Have you seen those bracelets being sold online that claim to treat erectile dysfunction? Are they actually worth trying? That's exactly what we're covering today. Because if you've spotted these products and wondered whether there's anything to them, you deserve a straight answer. Erectile dysfunction, or ED, is when a man has persistent difficulty achieving or maintaining an erection. It's more common than many people realize, and it can have a real impact on confidence and quality of life. So it's completely understandable that men look for solutions, including ones that seem simple and discreet. But here's what the evidence actually says. Most of these bracelets claim to work through one of three mechanisms: acupressure, magnetic therapy, or low-level electrical stimulation. Some draw on ideas from traditional Chinese medicine, suggesting that pressure points on the wrist are connected to sexual function. Others claim their electrical pulses can influence nerve pathways or blood flow. The problem is that none of these mechanisms have been scientifically validated for erectile function. There are no high-quality, randomized controlled trials demonstrating that wrist-worn bracelets can effectively treat ED. Put simply, there is no established clinical evidence that they work. It's also worth understanding how these products are regulated. In the UK, any device making medical claims to treat a condition like ED would need to comply with the UK Medical Devices Regulations and carry UKCA or CE marking demonstrating it meets safety and performance requirements. However, many of these bracelets are sold as wellness or lifestyle products rather than medical devices, which means they may avoid that level of scrutiny entirely. Being sold legally doesn't mean something has been proven to work. Meanwhile, there are treatments for ED that do have robust clinical evidence behind them. NHS-approved options include PDE5 inhibitors, medicines like sildenafil, as well as vacuum erection devices, and in some cases, intracavernosal injections. These have all been through rigorous clinical trials and are available through proper medical channels. There's another important reason why seeing a doctor matters here. Erectile dysfunction can sometimes be an early sign of an underlying health condition, particularly cardiovascular disease or diabetes. A GP assessment doesn't just address the ED, it looks at the bigger picture of your health. That's something no bracelet can do. So if you're experiencing persistent erectile difficulties, it's worth speaking to your GP about a full assessment, including cardiovascular risk and which evidence-based treatments might be right for you. If you've already tried one of these wearable devices, let your doctor know. They won't judge you, and it helps them understand the full picture. On the safety side, if your ED is new, persistent, or accompanied by symptoms like chest pain, breathlessness, or fatigue, please don't delay getting medical attention. These could point to something that needs proper assessment. And if you're already on prescribed treatment, always follow your doctor's instructions. Never adjust or stop medication without speaking to them first. So to recap, there is no established clinical evidence that wrist-worn bracelets can treat erectile dysfunction. The mechanisms they claim to use haven't been scientifically validated, and because ED can sometimes signal an underlying health condition, a proper GP assessment is genuinely important, not just for treatment, but for your overall well-being. For more information, visit the NHS website on erectile dysfunction or contact your GP or NHS 111. If you experience chest pain or severe breathlessness, call 999. If you found this helpful, drop a comment below, especially if there's another health topic you'd like us to cover. Give this video a like and subscribe to the Bolt Pharmacy channel so you don't miss what's coming next.